Hi everybody, this is Steve Nahuson and today's date is April the 11th, 2020. It happens to be the Easter long weekend and it's definitely a video that I never expected to be making. We're in the middle of a crisis here in Australia and around the world with regards to a virus that has infected the entire world. No country really has been unaffected by this. It originated towards the end of last year, around about October, November, were the first cases reported in Wuhan in China. And it seemed like at that time that the problem was really going to be isolated to China itself, but over the coming weeks and months, it soon became apparent that viruses of this sort that are highly contagious and easily transmitted from person to person soon become the world's problem, because people travel around the world, people come in contact with each other, and of course they then pass the virus. Now, what is so concerning about this particular virus is firstly how easy it is to be transmitted, and secondly the effects that it has on the population in general, but in particular those who are elderly and those who are indigenous, and also those who have got issues with autoimmune diseases and otherwise are compromised because of other illnesses they may have in their system. So at the moment in Australia, we're in a situation where we've got around about 6,500 people who have been infected by the disease, and so far we've had 58 deaths. Now, Australia in general is actually doing quite well in regards to maintaining some sort of controls over the spread of this virus and also trying to limit the number of deaths. Any deaths, of course, are terribly tragic and should never happen in the first place. But when you compare us to other countries like the US and Italy and Spain, comparatively our numbers are quite low. The US is actually leading the number of infections around the world, with something like 535,000 people in that country who have been infected by COVID-19, and they've recorded more than 20,000 deaths. The city that's the hardest hit in the US is New York City. Italy comes in after that with about 150,000 recorded illnesses so far and 19,500 deaths. And Spain, 163,000 people have been affected by COVID-19 and 16,600 have died from it. So the government's efforts in Australia are really around what they call flattening the curve. Typically these sort of pandemics can take off very quickly and we get a large spike in the number of people who are infected, because as people come in more contact with each other, the numbers just extrapolate outwards. So Australia has all been about trying to contain the virus through self-isolation and shutting things down, basically, stopping people from gathering in public or meeting each other or just going about their lives where they may actually come in contact with others. So it's all about self-isolation. And in doing so, we've actually stopped that sort of spike from really occurring, and the worry there was of course that our intensive care units in hospitals would become overwhelmed and we wouldn't be able to treat the sick effectively. So the flattening of the curve is actually taking that spike into more of a flatter curve to allow our healthcare system to really cope with the number of people that are getting sick. And so far it seems to be working. But in doing that, the Australian government has had to bring in some very draconian measures and laws, which really is all about stopping people from getting out and doing their daily lives, really, which is how that virus spreads. So some of the things that have been brought into place, there's of course travel bans, so international travel is really banned, and we've also closed each state border as well, so the ability to travel from state to state is really no longer possible unless it's for business purposes, and they have to be really well documented. You actually now need a travel visa or a pass to get from New South Wales to Queensland and back again. And so, of course, limiting that number of people crossing those borders and coming in contact with other states is really, really important. Not only are our borders closed, but also our schools have closed as well. So they've been closed for about a week now. They're on school holidays, but they're not going to return after the Easter break, which is where we're currently sitting. Many businesses have also closed. The ones that have remained open are considered to be essential services. So, of course, shopping and groceries and food and those sorts of things, petrol stations and the like. Some shops are also remaining open, but many shops have also closed. Bars, restaurants and pubs have virtually closed, and restaurants are now only allowed to serve takeaway food. About a week and a half ago we started seeing these signs of really nice restaurants in Brisbane that for the first time in their history have actually started serving takeaway food, and now all of them pretty much are doing it. Unemployment has gone through the roof, and the government is providing a lot of assistance and funding for those people who now find themselves out of work. And of course there's now financial assistance for people too who are unable to pay their rents. They've enforced a no eviction ruling, so people who have investment properties where tenants are actually in there but unable to pay rent because the breadwinners of those households have lost their jobs, the government has brought in a rule that those people cannot be evicted for the next 6 months, and then it's going to be reviewed after that. We've been asked this Easter long weekend to self-isolate and just stay home. So if you have a holiday house or an apartment at the coast, you're not allowed to travel to the coast to spend the weekend away. You have to stay in your principal place of residence. The number of visitors to your household has been limited as well, so you're only allowed to have a maximum of 2 people visiting your household, and those 2 people have to be known to you. So for example, if Reese came and visited and he brought a friend with him who he hadn't met before, that would not be allowed. There are quite hefty fines for people who don't actually follow these rules, and in Queensland, it does vary from state to state, but in Queensland the fine is $1,334. So you can be fined for doing things such as going to the park and sitting on a park bench and reading a book, for example. Now in most cases police are acting with common sense and they're just moving people along, but in Queensland so far the state has issued more than $500,000 worth of fines to people who are breaching the guidelines. So the sorts of things you can do: you can go out for essential travel, and essential travel is to donate blood, to perform your work. It's very important to keep some parts of the economy going, so the government is encouraging those who can work continue doing so. Go out and exercise, and to go out for food. Now the whole exercise thing has really created this situation now that we live here at Newstead. We're very close to the Brisbane River, and we love to go for a walk along the river. It's actually a beautiful part of the city to be exercising and getting out and about. But the problem is, because exercise is one of those few things that you can actually do outside legitimately without being in trouble by the police, everybody seems to go out there and do it. And a number of times we've been out there somewhere between 4:30 to 6 o'clock in the evening, which is a beautiful time of the day, and it is packed. There's people everywhere. There's people running and jogging, and they're breathing and sweating and carrying on, and frankly it's just too busy. So what Jenny and I and Reese do typically is that we go out for a walk with the dogs around about 9 o'clock at night, and we go for quite a long walk, around about 5 or 6k, and that way the streets are mostly quiet, and we can get out there and get our exercise and also get our outdoor fix without feeling a bit compromised because of the number of people out there. Because the whole idea is self-isolate, stay distance away from each other. We're all meant to stay a minimum of 1.5 meters away from each other. When you go to the shops now, the shopping centres, the Woolworths and those sort of places, and they have crosses on the ground, and people have to line up a gap between each, and they have people, security guards and staff standing out the front now, a bit like getting into a nightclub. They're actually regulated. They're only allowed to have so many people in based on the square meterage of the shop, and then one by one, as people come out of the store, they let people back into the store at the same time. That way not creating a situation where there's too many people crowding the aisles of the shops. It's a very strange situation, and it's just one that I never could have imagined. This whole thing seems to have also happened very quickly, so it only seems like a month, 6 weeks ago that we weren't even sort of really contemplating any of these, and we've now just finished our 3rd week of working from home. Jenny and I are both working from home, as are many people, and the self-isolation seems to have happened very, very fast. There's lots of shortages on certain items, so some foodstuffs are in short supply. The first thing that actually went in short supply was toilet paper. It was really embarrassing. The Australians just bought toilet paper. It was reported around the world of how silly the Australians were. There was even some scenes of people fighting in the aisles in the Woolworths in Sydney, and those people got arrested and had to go to court because it was just so ridiculous. But if you go to the shops now, it's very hard to get pasta and rice, pasta sauce. There are a lot of food items that are now have got limits. You can only get 2 cans of tinned tomato, for example, and so on, because rations had to be imposed just so people wouldn't go out there and buy too much of non-perishable items. The other products that are also hard to get is exercise equipment, so dumbbells and the like. Reese was really hoping to get some dumbbells for his apartment, and we've been out to a few places and there's just nothing on the shelves of the stores. And buying it online, you can buy them online, but as I said, it's early to mid-April at the moment, and the delivery times for a lot of this equipment is not until July, so that's not really great. Beaches are closed, so they've had to shut down beaches because people were just flocking to the beaches. The weather outside is beautiful at the moment. It's in the high 20s, not a cloud in the sky and hardly any wind, so people were just wanting to go to the beaches. And they found that was actually a potential hotspot for transmission of this illness. Equipment in parks for kids to play on is closed. It's just unbelievable what life as we know it has really changed. Now the concerning thing is that we really don't know how long these bans are going to last for. So the government is saying it could be 6 months, it could be longer, it might be until a vaccine is found, and they don't even know for sure that a vaccine can be found for this virus. There's no Aussie rules this year, there's no NRL, all the sport has been suspended, so we've got no sport to watch. And the clubs are really doing it tough. The players have had to take pay cuts of 50 to 80%. Most of the staff in all the major clubs have been stood down, and it's just a matter of even if these clubs can survive or not. So it's that dire. The NRL is talking about trying to restart the season, and they're talking about maybe the 28th of May there might be a limited season of some sort. But that's also been met with a lot of controversy because the government actually hasn't approved it. So, of course, football isn't just about the players, it's also about all the support staff as well, and that would require a whole lot of people to maintain effectively running operating teams, and just the nature of the contact sport and everything else actually really represents a risk. So I'm not even sure whether the season is even going to start up again this year. Interestingly enough, for the NRL and for the AFL, they did play the first round or two for those sports, and they actually played them in empty stadiums, which was really bizarre to watch. Again, situations like we've never really seen before. So we're just bunkered down at the moment. We're really expecting to be living like this probably for the next few months at least, maybe until August or September. Of course, in August of this year, Sam and Brittany were going to get married, but their wedding was cancelled by the venue because weddings are no longer allowed. You can have a backyard wedding with a maximum of 5 people, and those 5 people include not only the bride and groom but also the marriage settlement. So a wedding these days is almost impossible. Funerals have also been limited to 10 people. Now the other concerning thing that we do have at the moment too is that we're just entering our flu season, so the government and the health authorities are quite worried about the compounding effect of people getting the flu and COVID as well. Now just a little bit about where the virus actually started. It's believed that the virus started in Wuhan in China, and it's also believed that the virus, there's a whole lot of conspiracy theories about who may have started the virus and whether it was a deliberate thing, but it's most likely that the virus started in what they call wet markets, which is a really disgusting thing. It's where they actually have live and dead animals side by side in these disgusting markets in China. And the animals can be all sorts of animals, from domesticated animals and animals caught in the wild that are brought into these markets for people mostly to eat. But the common theory is that it actually started in bats. So people were consuming bats, and the virus somehow jumped from an animal to a human and then was able to spread between humans. There have been a couple of cases reported of animals catching COVID-19. There was a tiger overseas that was reported to have caught it. There's also been some reportings of domestic animals like dogs or cats who have caught it. But I don't believe there's ever been a report so far of it going to an animal and then the animal transferring it to other humans. But you never know, it's a bit of a changing situation. And these viruses do have a tendency to change as well over time and morph into different strains of this particular type of coronavirus, as it's called. The other thing that is in short supply is, of course, hand sanitizer, which has become really quite a sought after commodity. We've also learnt quite a lot about hand sanitizers, that really it has to have somewhere between 70 and 80% alcohol in the sanitizer itself to become effective. These sanitizers that are alcohol free really aren't effective at killing or destroying the actual virus itself. So getting a good quality hand sanitizer with a high alcohol content but not too high is boring. Okay, let's go and have a chat to some old folk and see how they're dealing with this COVID-19 crisis.
We can't do what we normally do. We can't go and get a cup of coffee across the road. We can't go shopping, and we've got our kids that think they're our parents. But apart from that, we're okay. We've had a few spats on and off, haven't we? But we come out of it because we're in each other's hair.
Yeah, I'm just missing a bit of golf, but trying to stop within government rules and regulations. But outside that, I'm handling it all right. I just bought a new scooter to play golf in, and having a bit of trouble adjusting it to get in the car and with the ramps and that, but we'll sort it out and get back to golf as soon as they let us play.
Are you worried about anything at all?
No.
No.
Not at all.
The government's been quite good. They gave us $750 each, which helped us a lot, and we can live a bit better because of that. But that's life, and you just got to put up with what you got.
I don't think it's as bad as it was during the war. I think life was pretty bad then. But at least they could go out and mix with people.
I got to be extremely careful because when I was 9 years old, I got pneumonia, then it changed to pleurisy. And I was in the Mater Hospital in a coma for 9 days, so my lungs are not what they should be, but I'm still handling it all right, and I just try and be careful, that's all. Outside that, I still walk all right and it's not affecting me.
We go for a walk every day around the park. I've got dermatitis because I've been washing my hands so much.
Washing your hands frequently and properly has never been more important.
Yeah, I got dermatitis there from washing my hands too much. But I don't think that alcohol hand cleaner's too good because it dries your skin out and makes it it affects your hands.
We're very grateful for our family that keep an eye on us.
A lot of people have also taken to wearing face masks as well. Face masks and personal protection equipment, or PPE as it's called in the hospitals, is in global short supply. So the ability to get face masks to help either protect you from airborne bacteria and virus, or if you're feeling sick, projecting it out is also a really good precaution to be taking. So Jenny actually has made a whole bunch of masks for members of the family, and they're particularly cute. So I'm not sure if you can see it, but they have little dog motifs on it, and so we do wear it when we go out in areas where we think we're going to be around a lot of people. But it does feel a little bit funny, I must admit, wearing a mask out in public, and people do look at you a bit strangely, but it's one of those precautions that you do need to follow because none of us want to get sick. Recent advice from the Australian government as well, as we enter different stages of our isolation, is that certain groups, the community, as I mentioned before, are more at risk than others. So they're recommending that people over the age of 70 should self-isolate and not come out for virtually any reason unless it's an emergency. We've suggested to Jenny's parents that they don't leave the house, and so for the last couple of weeks now we've been getting some shopping lists from Jenny's mum by email, and Jenny picks up some groceries and we take them over for her and Neil so they don't have to go outside. They do go outside to exercise, they walk in their park, which is important, but they do need to get outside and get some fresh air. And the good thing about the park where they live is that it's quite open, so provided they can sort of stay away from all those joggers and people out exercising, it's really good for them to get out and get some fresh air. But it's better that they don't go into the shopping centres where there's a lot of surfaces where the virus can actually live for quite some time. Stainless steel is actually the worst. It can actually stay active for up to 3 days on a stainless steel surface, and it also can be airborne for quite a period of time as well. There has been some research that has proven that in outdoor areas, if somebody coughs, that airborne particle of the virus can actually travel as far as 20 metres. If you're walking along a pathway and somebody in front of you coughs, you might actually walk through their slipstream and potentially pick up the virus if they are infected. This element of the virus has created, in some cases, a bit of panic, but a lot of it's also been a bit of a media beat up as well, which has created a lot of concern in the community. But the balance is that you also need to take some sensible precautions and not get exposed to the virus, because the last thing that we would want to do is inadvertently infect Jenny's parents through us coming in contact with somebody with the virus. So that's my check-in for today. But at this point, we're remaining really optimistic that we're going to continue to flatten that curve, and hopefully these restrictions can start being lifted slowly. And ultimately, it would be fantastic if the government and the scientists out there were able to come up with a vaccine for this hideous virus. Go the scientists and healthcare workers, you are our heroes. We absolutely really do respect everything that you're doing and how you're helping the communities. And we don't underestimate the difficult circumstances and the work environments that you find yourselves in as well. One of the alarming trends in Australia and probably around the world is the number of health workers who have also become infected. We salute you and we thank you for your work and your sacrifice, and together we can all get through this. Steve Nahuson on a fairly somber note today, signing off for now.